I'm Julia Walters, Communications Specialist with Kingman Regional Medical Center. You're watching our COVID-19 video update series, keeping our community and staff informed about issues surrounding the pandemic. Today, we're speaking with Dr. Lunn of Critical Care Medicine in the ICU about treatment options and medication for COVID-19. First, we're going to go to Nursing Practice Manager Sarah Schritter with today's numbers.
Thanks, Julia. As of today, August 11th, we have tested 6,880 patients for COVID. 422 are positive, 6,285 are negative, and we have 173 tests pending. We have an overall positive percentage rate of 6%. Currently in-house today, we have 10 patients on isolation related to COVID. Of the 10 patients, 6 are positive and 4 are rule-outs. I wanted to take this opportunity to thank all of our staff. These past few months have been challenging for all of us, but especially for those on the front lines. We deeply appreciate the work you do every day as our healthcare system is tested. You are our healthcare heroes, and we thank you for taking care of our community, our family, and our friends.
Thank you, Sarah. Now we'll head up to the CVICU to talk to Dr. Lund. We're here today with Dr. Lund, intensive and critical care physician here at KRMC. And we're up in the CVICU, and he's going to tell us about how we treat our COVID patients. So Dr. Lund, thank you for being here today. Thank you for taking the time to tell us about all this. Can you explain to our viewers what this setup is?
Well, it's driven by the patients, right? And what therapy they're getting. So the big danger with patients with COVID is they can aerosolize their secretions, not droplets, but actually get in fine mists that go everywhere, right? Okay. So we have created these rooms which are negative pressure rooms. And a negative pressure room is such that the air is taken from this room and ejected out into the atmosphere, and it creates negative pressure there. And that's what this is here for, so that when we come in and out of the room, none of that aerosol can follow with us.
Okay.
And the patients that need that are patients that are on BiPAP therapy or high flow nasal cannula sorts of things. And then this serves as an anti-room, so that when this is closed, people can get out of their sterile, or not sterile, but their protective gear,
okay,
dispose of it, and then come out of the room.
And that's when these doors are closed.
Correct.
Right? Okay.
Right.
Okay, so we also use something called a RotoProne bed, right, to treat patients. Right. Can you tell us a little bit about that?
The RotoProne bed was developed because basically of prone therapy during a disease called ARDS, which COVID lung is a derivative of, a derivation of. And when people are in a prone position, you can increase their oxygen because there's mechanical changes in the chest, and there's changes in the distribution of these infiltrates that they have. And it's been a therapy for 40 years, ever since I was a resident. But we had to turn patients manually.
Right.
And these patients have breathing tubes, IVs, urinary catheters, et cetera. Very complex,
yeah.
And so not only is it physically demanding, but there's all kinds of things that can go wrong with it. So these RotoProne beds have been developed, which are encapsulate a patient basically, and are mechanically driven, so that all these devices we have a pathway within this cylinder, right, that rotates.
Everything
with the
is
patient.
able to turn with the patient
so it's
appropriately.
Much safer, both in terms of the workers and their backs and so on and so forth, and the devices that the patients have placed in them for monitoring and care. And we've used it extensively, and it's really a benefit to our patients.
Great. So now we're going to talk a little bit more about the pharmaceutical side of treating COVID-19. Can you tell us about that?
Well, there's several things that have been tried. Actemra is a drug that's been used for this cytokine storm that people have. We've used that. We use convalescent plasma, and we use steroids, Decadron, for 10-day courses. And then we use Remdesivir. And Remdesivir is You know, it's being used under a special use declaration by the FDA. It's not approved for this use, but it's widely used in the United States. It's a drug that's given intravenously, and it's given on day 1 with twice the dose that it's given on day 2 through 5 or 2 through 10. There's 2 courses, either a 10-day course or a 5-day course. Okay. And it's a drug that was originally developed for Ebola disease.
Really?
So this drug is a prodrug. People take it. It gets into the cell. The virus uses the cell's machinery and some of its own machinery to replicate themselves, RNA. And this drug acts as an analog and gets substituted for parts of the RNA.
Okay.
And that inactivates that virus or makes it defective, makes it so it can't replicate. And so over a period of time, the number of viri apparently decrease.
Okay.
Well, if you look at the real truth behind it, it will take the average decrease in the duration of the disease is only from 15 to about 10 or 11 days. And it's not efficacious. It doesn't work in people that end up in RICU.
Okay.
It's for early in the disease.
Early
and
treatment.
our patients are receiving it out in the floor or out in the PCU. And by the time they get to us in the ICU, their course has been completed.
Okay.
It seems to help with the duration of the disease, like I said. It possibly has a mortality benefit if you give it early for people that need oxygen, but it's of no benefit to people that are on ventilators or other non-invasive breathing treatments.
Okay, so by that point, it's not helpful.
Right, it's helpful early in the course of the disease.
Okay.
Yeah.
Thank you for watching our COVID-19 update series. For more information, visit our website at azkrmc.com/COVID-19 and follow Kingman Regional Medical Center on Facebook. I'm Julia Walters. Until next time, stay safe and healthy.